Yesterday, Health and Human Services Secretary Alex Azar told states to expand priority access to tens of millions of additional people immediately. So now essentially 150 million people are at the front of the line to get the vaccine. So Jason, what effect will this have on the rollout?
Right. So when everybody has priority, nobody has priority. And while I understand the intention of this announcement to help accelerate the rollout of the vaccine, that's what needs to happen. No one doubts that. We need to figure out what's going wrong and how to do it better by telling nearly a third or more of the country that it's now their time in the line, while we know we're not going to have the vaccine doses or the capacity to get those individuals vaccinated for months. I worry does more harm than good. It creates confusion. It's going to add to the frustration, just as the Trump team's heading out the door and the Biden team's coming in. So it doesn't seem to be the solution to the problems we're seeing right now with the rollout.
And one of those problems is getting states to use the doses that they have, correct? And so how does the federal government incentivize or get people to use the vaccine?
Yeah, for reasons that are really hard to understand. The Trump administration decided that for all the hands-on direct investment and support they provided to the development of the vaccines, the manufacturing of the vaccines, and the shipping of the vaccines to states, their involvement effectively ends when those vaccines arrive in states, so that the last mile activities, as it's referred to, are basically left to state and local health departments to figure out for themselves. And those groups are strained under normal circumstances, let alone a year into a historic pandemic. So they've been tasked with really the most critical part of the vaccine delivery program. And they've been given very little federal support, very little federal guidance or funding to make that happen. So you've seen this fragmented piecemeal approach with no two states doing it exactly the same, some doing better than others, but really trying to scramble to get these vaccines administered. And this is at the easiest stage of the vaccine rollout. Only gets harder from here as we move from healthcare workers and long-term care facility residents, that's where we've been focused now, to broader populations. So the work only gets harder. And we definitely need a reset. And the inauguration of the Biden administration, I think, gives us an opportunity to really take stock of where we are and where we need to go.
So what is the first thing that the Biden administration can do to make this rollout smoother at the state level?
Money is often the challenge in policy that states and the public health community had been pleading for billions of dollars, frankly, to support the vaccination program since the summer. And those pleas were frankly ignored until this most recent relief bill, where there's now $9 billion set aside to support state rollout activities. That will help them. That will help states build those information technology infrastructures that we hear are struggling, these sort of creaky websites that are failing to meet the needs of individuals trying to find a vaccine appointment, to help target communications efforts, and to help build the kinds of ancillary vaccination facilities, vaccination clinics, mass vaccination clinics, mobile vaccination clinics, that we think, and I think we're pretty confident, are going to need to be part of a comprehensive solution. Money will be part of this solution that the federal government can and should provide, and $9 million might be a down payment. That's what the Biden team has said. I think they're right. And also they need to provide more federal guidance that this shouldn't be a 50-state fragmented approach. We've sort of seen the problems we run into when we try that in responding to this pandemic over the last year. There's a real important role for federal guidance, federal coordination, federal support, not a federal takeover, but federal support to help states implement these strategies, these programs that they're all trying to do right now in real time.
One move the Trump administration has also made is to decide to release this reserve of doses that they were saving for the secondary booster shot that would be given, about a month after people are vaccinated. Does that make you nervous about these booster shots? Are people going to be able to get their boosters?
Yeah, so this is something I think makes sense, unlike the decision to really blow up the priorities framework. that was announced yesterday. The idea of holding back these second doses and keeping them in reserve for this first month of the vaccination program was effectively an insurance policy, as we were learning more about the way in which these vaccines were being manufactured. Were they being produced in a reliable, predictable way so that we could count on having more doses each week, each month, and to have those doses a month after dose 1 had been administered, so that there'd be a dose 2 waiting for the public. We've now seen enough, I think, over this past 4 or 5 weeks to say we can be pretty confident that we're able to manufacture vaccines and distribute them in a reliable way. So it no longer, frankly, makes sense, I think, to hold back those 20 million doses or so that have been sitting in freezers waiting to be the balance of the vaccine series for those who have gotten it. Now, it's great. We'll have twice as many vaccines potentially becoming available every week, but that means we have twice as much urgency to figure out ways to get those vaccines into people's arms that we're already failing to do with what we have. So I think that only underscores this idea that the delivery administration need really is the crisis. It's really what's holding back this vaccine program, not necessarily the number of doses right now, despite what people expected.